Hello, I'm Dr. Becky Strauss. I'm one of the clinical leads for Locala Sexual Health in Kirklees. We've got 2 clinics available for young people. One of them's in Dewsbury and the other in Huddersfield. Both are completely free and confidential.
If you want to come to the Dewsbury Health Centre, it's dead easy to find. It's just near the train station. It's also near the bus station and the sports centre, so it's really easy to find. If you want to come to the Sexual Health Centre in Huddersfield, it is at the Princess Royal Community Health Centre on Greenhead Road.
When we made this video, we were still managing coronavirus, and anybody wanting to come to the clinic would have to ring up and make an appointment. But under normal circumstances, young people can just drop in and see us during our walk-in and wait. For up-to-date information about opening times, you can check out our website. We know that some people can find it a bit awkward coming to the sexual health clinic, but we made this short film to make it easier for young people to access our services, and hopefully we'll answer some of the questions you may have.
Do I have to book an appointment to come here?
Normally you wouldn't know. Normally we do like a drop-in type thing, but obviously due to COVID-19 at the moment things are a bit different. So all you have to do is give us a call. The number's on there, okay? Or I've got a card that I can go get you, and just give us a ring and we'll get one of the doctors or nurses to ring you back, and then we'll arrange for you to come in. Is that okay?
Can I bring a friend with me?
Yeah, of course you can if you want. Normally, we like to see you on your own to start with, purely because there's certain questions that might be a bit embarrassing for you, quite personal questions. But no, by all means, if it makes you feel better bringing somebody with you, do it.
My mum is just on her way in. I don't want her to know that I've already had some contraception.
Oh, that's okay. You don't have to worry about that at all. It's completely confidential here. We would never give anything like that away. So if you don't want her to come in with you, that's fine as well.
Do I have to sign in anywhere?
Yeah, so when you come in, you'll fill in a registration form like this with your name, address, date of birth and a telephone number so we can get in touch with you, and then you'll just tick a box to say why you've come.
Is anybody else going to see my details?
Oh no, like I said before, it's a really confidential service. We wouldn't tell any of your friends, your relations, your GP even. And even when we send off for your tests, we don't use a name, it's a number, so people in the lab don't even know who you are. You've got nothing to worry about with that at all.
Are you going to tell my family doctor that I came here?
No, we don't have to. It's probably best we do see your doctor's records, just because if there's any medication we give you, we don't want it to interfere with anything that you might be prescribed from your GP.
Do I have to give my real name?
No, you don't have to give your real name, but it's better if you can, for reasons such as if we can register you properly then, and therefore we can get access to your GP records and see what medication you're on, things like that. So it does make it easier, but if you'd rather not, that's absolutely fine.
What happens after I've filled in the form?
Once you've filled in your registration form, you take a seat in the waiting room and then the doctor will call you in.
How long will I have to wait?
It's quite difficult to put a time on it really. It depends how many people are here, what they're here for. It may be that some people are more complicated and take time, but I don't think it should be too long.
So do people come here just for sexual health advice?
People come here for lots to do with sexual health, even if they've got no symptoms. They come for checkups for peace of mind. You can also come for anything to do with contraception or just any sort of worries you might have really.
How long does it take to have the meeting with the doctor?
All right, okay. It'll take as long as it takes. It depends what you're here for, how much you want to discuss with the doctor, but they'll spend as much time with you as needed.
Everybody I've seen here seems to be a woman. Are there any blokes?
Oh yeah, we get lots and lots. Sometimes they'll come in on their own, and all different ages as well. Sometimes they'll come with a partner, or a friend.
I've got a friend who said they were too embarrassed to come to the sexual health clinic. Do you have any advice for them?
Oh no, some people do feel like that, but honestly, please say, they mustn't feel like that at all. We're all really lovely. We're not here to judge people. We're just here to help. That's what we're here for.
Ali, do you want to come through? All right, just follow me. Come in. You look really nervous. Are you all right? Don't worry, it's quite normal. People to be nervous when they come. Come and have a seat.
Do I have to use medical words to tell you what the problem is?
No, not at all. You can use any words you want. We normally understand what you're saying. So you just tell me in your own words.
Do you have to tell my family doctor that I've come to see you?
No, not normally. So our records aren't shared with anybody. They just stay with us, okay? And we don't share your records with your GP. There might sometimes be reasons that we have to speak to either your family doctor or another health professional. But those reasons are only if we think you're in danger or if we're worried about you. And we'd always speak to you first about that. We wouldn't just go and do that without you knowing, okay?
Can someone still come to the clinic with me?
So normally we like to see people on their own, especially at first, and then if you want someone in with you later, that's okay. But we do like to see people on their own just because we ask quite a lot of personal questions. It's often easier when you're on your own.
If I'm not yet 16, will you tell my mum what we have talked about?
So if you're not 16, what we would do is check that you're mature enough to understand everything we're saying. And as long as you are, then there's no reason that we'd have to tell your parents that you've been here. We do see people who are under 16. We do often ask people who are under 16 a few more questions just to make sure that they're safe. So we'll often ask questions about who you live with and who your boyfriend is and how old they are, that type of thing. But all these questions are just to make sure that you're safe, okay?
What will the things that you will ask?
Okay, so when you come to the clinic, we normally ask you a medical history. That's about things like any medical problems, any medications you might be on. And then we ask you a sexual history. So that's some details about your sexual relationships, your partners, when you last had sex. So it's quite a lot of personal questions, but the reason we're asking those is so that we know what tests to do and when the right time is to do them.
Will I have to take my clothes off for you to look at me?
Not always, no. So often we can do tests without you having to be examined. So for women, you could do your own little swab. Okay, we just send you to the toilet to do that. And for men, they can just pee in a pot, so it's nice and easy. Sometimes if we're worried, we might need to get you on the couch and have a little look, okay? But we understand people are nervous and everyone's lovely here.
I don't want my mum to know that I'm on contraception.
Okay, your mum doesn't always have to know that you're on contraception, okay? What we normally say is that it's nice to be able to talk to either a parent or a trusted adult, and so we'd normally encourage you to do that. You might normally find that an adult would actually be quite proud of you for coming here. So we won't be telling anyone, but we'd sometimes encourage you to do that.
If I do have an infection, what will happen?
So if you have an infection, the first thing we'll do is give you some treatment, and that's normally just some antibiotics, okay? And then the other thing that's really important is that we treat any of your sexual partners. So that might be your current boyfriend, it might be somebody that you slept with a little while ago. And two ways of doing that, either you can tell them or we can tell them for you. But if we tell them, we wouldn't ever use your name.
Will I have to tell my partner that I've been here?
Not necessarily. Again, there might be some reasons why we might encourage you to tell your partner. Say if you've got an STI, for example, and your partner might also be at risk of that STI, but not always, no.
Will I have to pay for treatment or contraception?
So all STI treatment and contraception are completely free. You don't have to pay for any of that. And we give you that treatment while you're here in the clinic to take away with you, so you wouldn't have to go to your chemist or anything to get it.
What are some of the things that you would recommend to someone if they came in?
So if you want sexual health advice, there's a few places that you can go. There's some colleges provide a drop-in service for sexual health advice. You can go to your GP, or you can come to one of the sexual health clinics, either in Dewsbury or in Huddersfield. The main thing is that you go somewhere and see somebody.
Even if I don't have any signs, can I still come in?
If you've got no symptoms at all, we'd encourage you to come in for a checkup. We want people to have STI tests when they've got no symptoms, because some STIs don't have any symptoms.
What if I come in and it's a male doctor?
If you came in and there was a male doctor and you didn't want to see a male doctor, then you could request to see a female nurse or doctor instead. We'd always do our best to accommodate that. There just might be a longer wait sometimes.
What if I don't remember the information you gave me?
So we give lots of information when you come to clinic, and you probably won't remember it all. What we normally do is we give you send you a little leaflet to your phone, either about the contraception that we might have started you on, or if we've diagnosed an STI, we give you information about that STI, so you can take that home with you and read about it.
A friend of mine says she's on the pill, not because she's going to have sex. Is that true?
So there's lots of reasons women can be on the pill, and it's not always for contraception. Common reasons are that they might be on it for their acne, or they might be on it for heavy periods. So the pill's not always prescribed for contraception.
I've heard lads say that they have to put a big thing down your willy. Is that true?
So men are often worried about us putting big instruments down their penis, but that's not really the case anymore. A lot of the time, STI tests can just be done by a man peeing in a pot, which is nice and simple. Sometimes we will need to do a little swab, but it's over really quickly and it's actually not that painful.
I'm not really into girls. Could I come here if, I might be gay?
So if you're not into it, it doesn't matter what sexuality you are, you can come to our clinic. That's absolutely fine. In fact, we would encourage you to do that.
How can I help my partner remember to take her pill at the same time every day?
So lots of people struggle to take the pill, and there's lots of things we can do. So you can set a reminder on your phone, that's quite helpful. Or you could think about going on a different contraceptive method that's not the pill, that you don't have to remember. So we've got things like the implant, okay? Or we've got things like the coil, or we've got the contraceptive injection. So we can discuss all those options with you.
A friend of mine came here to get a contraception injection, and I know that she's worried she might forget to come back every 12 weeks.
So if you're on the injection, for example, normally what we'd encourage you to do is put a reminder on your phone, but you might not want that reminder to say contraceptive injection. So if you're worried about someone seeing that on your phone, you could just put anything as long as it means something to you, as long as you remember what it is.